name is Hayden Cannon, and this is my motivational speech on the American Nurses Association. The American Nurses Association is a countrywide organization that helps nurses grow and helps foster them into the career that they have entered. It offers educational standpoints within hospitals and just within the organization itself. Nursing is proven to be one of the most mentally and physically challenging professions that there is. Between lab work, any statistics that we have to know, patient care wise, it is mentally and physically draining within your own job. Because of this, nurses struggle with providing the self-care that they all deserve. Whenever we're busy and something happens with a patient, automatically we're going to go straight to the patient and not think about what we need ourselves as a nurse. The Nurses Association aids in creating a safe work environment for the nurses. Many people know patients can get very combative, they can get very hands-on, physical, and the Nurses Association is attempting to try to create a more safe environment. Not only with patient overload, we're trying to create a safe environment for ourselves, for the patients, for anything that could come in between that. Nurses have increased their patient intake load because of the nurse shortage. This has put nurses taking 6 to 7 patients per one nurse. This can create many errors in between, the nurse not being able to provide enough care for one patient than the other. Increased knowledge among management would defy this. This would increase the knowledge that they had to help benefit nurses and understand that the struggles that we do face on a daily basis. The struggle is in a crisis right now. There are almost every hospital in the country is begging nurses to come and work for them, offering incentives, anything that you could think of to try to just get nurses in the hospital. Because of the nursing burnout, because of the nursing crisis, many nurses experience nursing burnout. This has created a huge dilemma within. Because of the nursing burnout, there is unfortunately a thing known as nursing suicide at this point. Up to 56% of nurses are more increased to commit suicide because of the physical and mental burnout that they endure within this. Because of the nursing crisis as well, a lot of hospitals are understaffed, not only with nurses but with CNAs, certified nurses assistants, personal care technicians, anything that can help take the weight off of nurses. We are severely depleted in it. 80% of nurses say that their units are inadequately staffed. This can be with, like I said, nurses themselves, management, being present, CNAs, anything that could help take that pressure off of the nurses. The effects of shortages on nurses increases stress, obviously increases the work overload. It compromises nursing care to a minimum, to say the least, and some nurses, procedures are left out. That means that we are having to hand off procedures maybe to higher ups because we do not simply have the time to care for our patients the way that we need. From the CDC and prevention, like I mentioned earlier, 46% to 57% of healthcare workers are more prone to suicide and mental health crisis. The Department of Nursing states that nurses are at the highest risk of suicide rate within the country and within the healthcare profession itself. Because of this, Joe Biden has actually signed an act and a law to try to create more resources for nurses within and outside of hospital settings to make it a little bit easier for nurses and other healthcare professionals to get the mental health help that they need. 56% of healthcare professionals say that there is a stigma within healthcare that healthcare workers aren't supposed to get the mental health that they need. Nurses are one of the many providers that are on the front line if an emergency happens. As soon as you walk in the door in the emergency room, nurses are the first ones to greet you. Nurses spend more time with their patients than anyone's. Doctors only spend roughly about 10% of their day with their patients. Nurses spend 97% of their days with their patients. Whether it's patient care, explaining procedures, giving medications, providing self-care to the patient that nurses don't get themselves, we do that for you. An increase in nurses would take the stress off of everyone. It would take the stress off of a charge nurse, the main nurse who oversees everyone. who oversees every patient, every nurse, who is responsible for everything that happens on the floor. It would take stress off of the patients. It would increase time to add patient care. Since Joe Biden has signed this, over 50% of facilities in the United States have added mental health areas within their facilities. They have aided in providing free mental health care for nurses, for healthcare professionals to try to help them with this. Here are biological, environmental, and psychological factors. This shows substance abuse disorders, which are very common in overworked and mentally drained nurses, chronic pain, mental health challenges. This goes to job loss. You feel like you're in a crisis, you have no way out, and then finally you find your way out, and unfortunately this has led to suicide in many nurses. One of the most popular cases right now, her name is Tristan Kate Smith. She was a 28-year-old ER nurse who unfortunately committed suicide due to the lack of support that they had within the facility. She named her letter a letter to my abuser. The Nurses Association has done their best to create and solve the issue. We are still working forward. Over 75% of nurses in the United States are a part of the American Nurses Association, and we are all fighting to create and mend the broken system that we work within. Although it was short, my name is Hayden Cannon, and I thank you very, very much for being a part of my motivational speech.